Hello. Today we're going to be discussing meniscal repair in a recent biomechanical study published in the American Journal of Sports Medicine. We have with us in the studio Dr. Krych from Rochester, Minnesota, Dr. Travis Maak from Salt Lake City, Utah, and Dr. Pat Smith from Columbia, Missouri. Gentlemen, thank you for joining us today.
Thank you, Chris.
Thanks, Chris.
Thank you.
So Travis, can you please give us a brief summary of the paper?
Sure, I'd be happy to. This was a biomechanical study looking at all-inside and inside-out devices. There were 3 PEEK implants for the all-inside device, as well as FiberStitch, an all-suture-based all-inside device, and then suture tape and basic suture for the inside-out. And it looked biomechanically at pull-out strength, total load to failure, gap formation, and relief displacement, and tried to evaluate which one had the better and worse characteristics.
That was a great summary, Travis. Thank you. Now, Aaron and Pat, being the authors on this paper, can you please highlight the key results for us, specifically initial load and relief displacement?
Well, Chris, the initial load, what we did is we set all the repairs at a standard intraoperative tension of 50 newtons on the instron. And then what happened was we released the traction. So at that point, you knew exactly what was left that the device was holding the repair at. And that's the initial load. And then what we did is took the instron and took it down to 2 newtons to unload it to start our cyclic loading. But when you unload the construct, there is stiffness from the repair itself, so we could determine which one had the greatest relief displacement based on that unloading effect.
So Aaron, why are these results important to the repair and ultimately the patient?
Yeah, I mean, the bottom line is we want the meniscus repair to be successful. We have a lot of choice as surgeons, and we want to choose an implant that really has high primary fixation strength that's going to provide adequate compression at the repair site to allow that repair to heal.
Thanks, Aaron. Now, we all know that optimal healing is best achieved when the fixation secures the 2 tissues and resists gapping. Pat, can you please share the importance of testing the gap behavior during cyclic testing?
Well, Chris, we want to make sure that our repair stays together and it stays compressed. And that's important for us in our postoperative management of patients with knee range of motion when you start weight bearing. So the cyclic loading part of this paper was to determine which device gave us the best compression through that cyclic loading. And that translates directly into the care of our patients post-op.
That's very interesting, Pat. Now, Aaron, did anything surprise you when you tested inside-out versus all-inside techniques?
Yeah, I think, for me, this is one of the first apple-to-apple comparisons, trying to simulate real life, not only with repair in the operating room at time 0, but also with rehab. And clearly, all-inside did better than inside-out for both of those categories. And specifically, the all-suture-based all-inside construct did the best for both of those. And what do you think about the inside-out difference between suture tape versus the regular suture? Yeah, so for inside-out, I think it's really dependent on the strength of the knots. And when we're tying knots with the suture tape, I think it was clear they both had a higher fixation strength and resisted that gap formation a little bit better than standard inside-out suture.
So we all know the one test that can't be overlooked is ultimate strength. Aaron, can you share these results with us?
Yeah, so after we put the meniscus through its cyclic loading protocol, we then did an ultimate pull to failure. I think that allows us to assess really the weak points in each of those suture and repair constructs. And what we found was that the all-inside, all-suture did best. We found that the PEEK implant sometimes broke. Sometimes the PEEK implants actually pulled through the tissue. So having that broader backstop of the all-inside, all-suture was superior.
That's interesting. Now, Travis, it was mentioned that ultimate stiffness was measured simultaneously with ultimate strength. What did you learn?
So I think one of the biggest concerns with all-inside techniques is that the implants will not hold themselves well under ultimate cyclic loading. And what we found here, interestingly, was the all-inside, all-suture-based FiberStitch not only resisted gap formation, so stiffness was improved, but also it did not pull through. So ultimate strength was the best as well. So it actually was effectively the best of both worlds.
So, gentlemen, that was a great discussion of the study. Any final thoughts? And we'll start with you, Pat.
Well, Chris, I think that, FiberStitch came out on top here, and I think it really has to do with the design of the construct. This is an adjustable, knotless, tensionable device. So I think the fact that we have 2 sutures that we can adjust decreases the overall friction. And I think that's what allowed us to get these good numbers in terms of compression and less gap formation.
Travis?
So I think the 2 suture-based, what Pat was just talking about, allowing you to dial it in and get perfect compression of the meniscus was a very important takeaway from this study. But for me also, the ability to put an all suture-based implant into the capsule, have the highest pull-out strength of all, which is was the biggest concern for me, was really the biggest take-home.
Yeah, and for me, it comes down to, the successful meniscus repair. We want good compression. We want resistance to gap formation. And biomechanically, the FiberStitch really did the best job here.
That was great. Again, thank you again for joining us today.
Thanks, Chris.
Thanks, Chris.
Thank you.
Absolutely. So this has been a great discussion on the importance of meniscal preservation and the impact of this AJSM biomechanical study. Now, if you haven't had a chance, we encourage you to watch our other episode where we discuss the importance and principles of meniscal repair. Thank you for joining us.